Well, good afternoon, everyone, and Merry Christmas. Today there are 18,311 active cases of COVID-19 in Alberta. That's an increase from yesterday of 1,021 on 14,199 tests that were completed, which represents a positivity rate on those tests of 7.2%. 802 Albertans are in hospital because of COVID-19, of whom 152 are receiving intensive care. Sadly, 11 more Albertans have passed away from this disease, meaning that 871 Albertans have lost their lives due to COVID-19 since the beginning of the pandemic. And of course, as always, our condolences go out to all of the loved ones and friends of those, particularly those most recently passed away. On behalf of all Albertans, I extend our deepest sympathy to those, the family and friends of each and every one of those who've lost their lives to this virus all throughout the year. I am pleased to announce today that we've made some changes to the public health restrictions that will allow single Albertans to enjoy the holidays with loved ones in a safe way. Between December 23rd and December 28th, single Albertans may attend one event at another household. During that same time, households may host up to 2 single people for an event. This is a small change that was just adopted based on advice from the Minister of Health, with input from the Chief Medical Officer by the COVID Cabinet Committee, which just completed meeting. And it will make a world of difference for single Albertans who otherwise would not be able to visit their families over Christmas. I recall receiving an email from a constituent of mine in Calgary, Lougheed, who sadly lost his wife to cancer earlier this year. His son and daughter-in-law could visit him at home as a single individual, but he was unable to visit their children, his grandchildren, over Christmas. And this will be, I think, a meaningful opportunity for individuals in circumstances like that to have family support at Christmas time. Similarly, it will allow parents who would otherwise spend Christmas alone to welcome their children home for the holidays. Please know that the prohibition on large social gatherings remains over Christmas, and I regret that we could not make broader exemptions for holiday gatherings. But we have made tremendous progress in fighting COVID-19 over the last couple of weeks, and I'm asking for all of us to keep observing the rules. Together, we've come a long way, and we have a long way to keep going. Our Cabinet COVID Committee considered the many considerations around family gatherings at Christmas, and this much we know, as Dr. Hinshaw has said, this huge spike in cases that we've experienced over the past 2 months clearly began around dining room tables at Thanksgiving, intimate family gatherings where people got together, never expecting that those family gatherings would be the source of transmission. But many of the people who attended those gatherings went on to become hospitalized. Some lost their lives. And the broader spike in cases through social transmission clearly began at that point. And at that point, we had only a few dozen people in hospital with COVID. We now have 800 Albertans in hospital with COVID. If we were to gather in typical large extended family gatherings over the Christmas holidays, beginning with 800 people in hospital, there is absolutely no doubt that we would lose all of the progress that we have made in recent weeks, that we would be back into exponential growth. And it wouldn't take very much for those 800 cases in hospital to turn into 1,600 and for the 1,600 to turn into 3,200. And at that point, we would be completely overwhelming our healthcare system. As it is, there is extraordinary pressure on our healthcare system. We can cope with the current pressure thanks to the dedication and remarkable professionalism of our frontline healthcare workers. We can manage with 800 cases in hospital. We cannot manage with 2,500 COVID cases in hospital without beginning to deny some people care and without canceling all non-urgent surgeries and non-COVID related non-urgent health care. I remind folks who often say, well, all of this is based on exaggerated effects of PCR testing or what have you. No, Alberta's response is designed to prevent an overwhelming of the healthcare system, which would force widespread cancellations of surgeries, which would itself have massive effects on people's health unrelated to COVID. This is not a theory. This is not a model. This is not a political preference. It is a simple, hard, numerical reality of the pressure on the healthcare system, which, without these kinds of difficult restrictions and measures, would, within a matter of weeks, undoubtedly overwhelm Alberta's healthcare system. So we ask for people's understanding at this particular time of year as they gather in smaller household groups to please do everything you can to avoid turning Christmas into a super spreader event that could have a devastating impact on the lives and health of thousands of your fellow Albertans. Today, I have some other news about the vaccine program. 25,350 doses of the Pfizer vaccine arrived in the province and will be delivered to vaccine sites around Alberta. These doses will go to those critical healthcare and long-term care workers who are on the front lines looking after our most vulnerable Albertans, those living in continuing care centres and the sickest patients in our hospitals. Edmonton and Calgary will receive each 6,825 doses, and Red Deer will receive 1,950 doses. Another 9,750 Pfizer vaccine doses will go to 10 rural centres across the province to begin immunizing critical staff in those communities and surrounding areas. Those are Brooks, Camrose, Drumheller, Edson, Fort McMurray, Grand Prairie, Lethbridge, Medicine Hat, Pincher Creek, and St. Paul. They will each receive 975 vaccine doses. This vaccine requires ultra-cold storage, but thanks to the planning and prep work of our teams at Alberta Health Services, and the Vaccine Task Force, we've been able to safely and successfully receive these doses at locations in almost every corner of the province. Over the coming days, these vaccine doses will be placed in the capable hands of our public health nurses, who will administer them to frontline workers caring for those most at risk of COVID-19. Since the first shipment of 3,900 doses arrived in Alberta just last week, on December 14th, and we have administered 3,074 doses as of December 21st to our frontline healthcare workers. This is just the beginning of immunization, and I understand there's more that were administered actually since that report. I think the minister can give us an update. Since this is just the beginning of immunization in Alberta, but we're off to a strong start. We've been ready to receive and administer vaccine since day one, and will be ready to safely and quickly distribute all future doses into the arms of Albertans. The arrival of these doses provide a sense of hope and relief to all of us as we start this holiday season. Let them also be a great motivator to respect the public health measures that are in place. Thank you, and with that, I will turn it over to Minister of Health, Tyler Shandro, and then we'll hear from Dr. Deena Hinshaw.
Well, thank you very much, Premier, and good afternoon, everyone. As Premier just shared, we're delighted that the next Pfizer vaccine doses have arrived in Alberta. As of yesterday, over 3,000 healthcare workers have received their first shots. I think the exact number that was mentioned was 3,074. It's a bit of good news, and it's a bit of good news that we need. It's the beginning of the work that will roll back the pandemic once and for all. But it's only a small first step. In the meantime, we have to hold the pandemic back by following the restrictions that are in place over the holiday. And there's good news there too. Our active cases peaked recently at a bit over 21,000. And as Premier noted, today they were a bit over 18,000. That's real improvement. And it's happening because the daily case count is coming down. It looks like we're finally headed in the right direction here in Alberta. Now again, it's only a first step. We need to drive the daily case count a lot lower to start to take the pressure off of our hospitals. But it's a real change, and it's because Albertans are listening and they're doing the right thing. I want to give people some encouragement because we need to stick at it. It's important to remember that our total cases to date are only about 2% of our total population, and that means almost all of us are still susceptible. We're holding the virus back because almost all of us are limiting our contacts to the bare minimum. If we stop doing that, if we stop following the restrictions over the holiday, the numbers will not keep going down. We'll see, in fact, a whole another spike. And it's that simple. So my message today is just this. We're doing the right thing, it's working, and we need to stick at it. For its part, AHS will be hard at work over the holiday, getting the latest batch of vaccines to even more healthcare workers across the province. They're already booking appointments at all immunization sites. Over the next 10 days, they're aiming to give the first dose of vaccines to about another 6,750 healthcare workers. And I'm proud to announce this because it's a concrete way to show we're there for the people who are in the healthcare system the way that they've been there for us. Now, I've been touched by their comments about what the vaccine means to them. But I know that there are two things that they want even more. They want patients to get vaccinated, and they want us to get the case numbers down so that we stop stretching the ICUs and the other units beyond their normal capacity, and so we can stop deferring other care. Those healthcare workers are doing so much more than their part. The rest of it is on us. Now, before I wrap up, I have a few other pieces of news to share. We know the importance of massage therapy for recovery from acute pain and chronic pain, and our health professions and individual Albertans have raised concerns that the current restrictions have stopped patients here in Alberta from accessing this care. Now, we've listened to those concerns, and we've worked with Dr. Hinshaw to grant an exemption to allow massage therapy services for patients or clients with either a prescription from a physician or a referral from another regulated health professional, understanding that many massage therapists work in the same clinic as a chiropractor or a physiotherapist, or get the referrals from a chiropractor or physiotherapist. Now, massage therapists will be subject to requirements for appropriate hygiene, requirements for masking, and other barriers or personal protective equipment or PPE to protect both the client and the service provider. Dr. Hinshaw has also made amendments to allow for private counseling services. We recognize that these services are critical, especially over the holiday season. And finally, we've made an amendment to allow visits at home at the end of life for a family member, a friend, a faith leader, or other person. The final moments of life are precious, and this exception will allow for them to be shared with loved ones. Now, thank you very much, and I will now invite Dr. Hinshaw to provide today's COVID-19 update.
Thank you, Minister, and good afternoon. As you have already heard, a high-level overview of today's numbers from the Premier, I will keep my remarks brief. As you heard, for the upcoming holiday season, we are providing a one-time exemption to the gathering limit for people who live alone. Between December 23rd and 28th, an individual living alone may join another household for one gathering only during this period. A household must only host a maximum of 2 people who live alone, not including minors, and only one event. This approach strives to balance mental wellness for individuals living alone and the need to limit COVID-19 spread. To be clear, we are providing a 5-day window from December 23rd to 28th to accommodate schedules for first responders and others who may work variable shifts. However, an individual living alone may only attend one gathering during this time. If gathering with someone who is at higher risk of severe outcomes, such as someone over the age of 65 or someone with chronic conditions, please make sure that all gathering safety measures are applied continuously. Please find a way to ensure that person can participate in the event while still being able to maintain 2 meters of distance from all others. You can also take practical steps to protect them by making sure they have access to hand sanitizer at all times, and you can consider asking others not typically in contact with that person to wear masks while in a room with them where distancing may not be possible at all times. With respect to our COVID-19 response, I know that one topic of great interest to Albertans is our contact tracing system. Alberta Health Services continues to bolster the number of contact tracers helping to protect Albertans. They now have about 1,200 contact tracers and are on track to have close to 1,600 by the end of the year. The contact tracing team will continue to work day and night throughout the holidays, and I want to acknowledge their hard work and thank them. COVID-19 obviously doesn't take a break, and I'm extremely grateful to all of our healthcare workers who are spending this season caring for patients and responding to the pandemic. During the next week and a half, AHS will continue to carry out case investigations and contact tracing for cases, including those in students and school staff. As per their usual process, AHS will ask school administration to provide class lists and contact information for close contacts to help notify those who may have been exposed. However, there will be some instances where school administrative staff are not available during the holiday period. In these cases, AHS will not be able to contact parents of children who may have been exposed to a case. This again highlights the absolute need for people, including children, to stay home if they are feeling unwell and to continue to follow all public health measures currently in place. I know this is a challenging time of year for many. In many ways, those in continuing care are particularly challenged right now. This week, I wrote letters to operators and families of residents, encouraging them to follow all the restrictions in place while acknowledging the impact of these restrictions on them. This includes the request that all designated family or support persons limit their presence on site as much as possible. If there are ways to care for mental and physical well-being by not entering the facility, please do so. I know this is a difficult time for those living and working in these facilities, and I hope all Albertans will show their kindness and support for those in continuing care. A letter, a card, or a call will go a long way. Finally, I want to also stress the importance of caring for your own mental health during this time of year. It's normal to feel increased levels of stress during the holiday season, and 2020 has been especially hard on all of us. If you are feeling sad, anxious, or upset, this is completely understandable and you are not alone in those feelings. Looking after our own and each other's mental health is just as important as washing hands regularly and staying home when sick. If you are struggling, remember that you are not alone. Confidential, non-judgmental support is available, even over the holidays. Alberta's Mental Health Helpline is available 24/7 and offers confidential support for mental health concerns. Alberta's Addiction Helpline is also available around the clock and offers confidential support for alcohol, tobacco, drugs, and problem gambling. This can also be a difficult time for children and youth, and the Kids Help Phone and Alberta Youth Mental Health Hub online are great tools. Please visit ahs.ca/help-in-tough-times for these phone numbers for more information and for additional resources. And as a reminder, mental health services, including psychiatry, individual and group counseling services, residential addiction treatment, and mutual support groups are not restricted under our current public health orders. they can continue to operate with the appropriate safety protocols in place. We all need help sometimes. If you need any support for your mental or physical health, please do not hesitate to seek assistance. Every single Albertan has been impacted by this virus and is doing their best to get through. This has been an extraordinary year. So for the rest of 2020, let's all approach each other with extraordinary kindness. Thank you, and we'll be happy to take questions.
As a reminder to those on the phone, we have a lot of reporters in the queue today, so please limit yourself to one question and be brief. Operator, can you please put through the first caller?
Thank you. Yes, the first caller is James Keller, Globe and Mail. Please go ahead.
Hi there. I've got a question about this COVID-19 variant. Is the province looking at any additional measures, such as mandatory testing for incoming travelers or things like that? And the Public Health Agency says this variant may already be in Canada. They're still investigating. So how likely is it, do you think, that this is already here and spreading within Alberta, considering the travel that has been happening this entire time? Some of that might be for the Premier, the Health Minister, and some of that might be for Dr. Hinshaw.
I'll maybe start and then hand it over. So first of all, the information that we currently have, we have no evidence that this variant is in Alberta or in Canada. But of course, we are doing additional testing, additional genetic testing to understand if that is the case. As of course, given that we don't do genetic testing on every single sample, it is possible, it's always possible that there could be a variant that has arrived. I want to emphasize, though, that our current public health measures will protect against this variant. What this variant does is it can, or at least there's some hypothesis that it may bind more effectively to human cells, but that has not been definitively proven. And it must come into contact with a person. So again, all of the measures that we currently have, distancing, masking, regular hand hygiene, all of those layers will protect against this virus. And so Albertans following all of these measures, those are ways to keep ourselves and each other safe. And with respect to the border measures, I'll maybe pass it over to Minister Shandro.
Thank you, Dr. Hinshaw. Thanks, James. Yeah, so AHS, as Dr. Hinshaw said, is doing gene sequencing. Of course, we can't do the gene sequencing on every patient in the province, but right now we haven't seen any evidence that I understand from AHS in the province of this variation. We have expanded our testing to anyone who has recently arrived from the United Kingdom so that they can and should get tested to make sure that they are not asymptomatic in the community. We're encouraging people who've come from the United Kingdom in the last 2 weeks to go get tested, and we'll continue to monitor this variation if it does happen to come to Alberta. But as Dr. Hinshaw has said, our current restrictions will protect us against spread of this variation, as with any of the many different variations that can occur with the coronavirus that causes COVID-19.
Operator, can you please put through the next caller?
Thank you. Yes, the next question is from Bill Kaufman, Post Media.
Yes. Hi, Dr. Hinshaw. I'm just wondering, how much do you think the latest restrictions and measures that were put into place how much of a role have those played in these smaller, high, active case numbers? It looks like they're about 46% below their height a couple weeks ago.
Thank you for the question. It's really important to remember that the individual days' variations in numbers are partly a function of how many tests are done in any given day. And so today I will note that our positivity remains at about 7%, which is not dissimilar to where we have been over the past few days. So again, of course, it's good news that our cases seem to have stabilized and are starting to come down, but we do need to watch all of those metrics, the new case, the positivity rate, as well as the R value, as we've talked about previously. So it's, from my perspective, I would say that the measures that were introduced in late November had an impact with respect to bringing our case numbers into a plateau. And when we layered on these additional restrictions that came into place, some of them came into place about 2 weeks ago, others about 10 days ago. We are starting to see again that layering on effect of these numbers starting to decline. However, we continue to have high case rates when compared to other provinces, and we need to stay the course. We need to make sure that these new measures put in place 10 days to 2 weeks ago get the full impact, that we are able to bring those numbers down so that we can lower the cases in hospital, as the Premier mentioned.
Operator, can you please put through the next caller?
Julia Wong, Global News.
Hi, just a quick clarification. I believe this would be perhaps for the Premier or for the Health Minister, and then a question for Dr. Hinshaw. So the first clarification is, with the second batch of vaccines, will the province be able to move into phase 1B of vaccinations, which would include home care staff, emergency room staff, or will it be strictly used for ICU staff and respiratory therapists and long-term care workers? And for Dr. Hinshaw, we're 9 days before the end of the year. How will AHS be able to hire for 400 positions in 9 days?
Thank you for the question. The work that AHS has been doing to advertise positions, to recruit to them, to do interviews and vet appropriate candidates, all of that work has been ongoing with many, many people. And so it's important to know that we're not talking about within 9 days starting that whole recruitment process, but actually finishing the recruitment process for many who have come far along, who are appropriate, who have been screened, and just now AHS is finishing up that hiring process. Now, I'll turn it over to Minister Shandro for the vaccine question.
Thanks, Julia. And maybe just to make sure I'm clear, you're wondering if about residents in long-term care or just the workers in long-term care, and I guess just generally moving, if it's possible to move to phase B, priority group B in phase 1. We not with these numbers right now. With the doses, we're still focusing on the priority groups in group A. At least until the end of January, even with these further numbers. But look, a lot of it's going to depend on when other vaccines get approved by Health Canada, and when those manufacturers can provide those doses to Alberta, and how more quickly we can move to priority group B as well as to phase 2 is going to depend on when we can get those other vaccines.
Operator, can you please put through the next caller?
Thank you. The next call is from Kevin Nimick, CTV Calgary.
Hi there. This question is for the Premier. Premier, you previously said the Arches supervised consumption site in Lethbridge was closed in part because of an investigation into unaccounted for funds. Today, Lethbridge police said that $1.5 million in provincial funding was accounted for. So will the facility be reopened?
Well, we don't decide whether the facility is open or not. It's the federal government that grants licenses, but we decide what we fund. And the threshold for what we spend tax dollars on is a lot different than the threshold of a potential successful criminal conviction. I'll refer you back to the audit that was conducted, as well as the comments emanating from people in the Lethbridge community about the huge damage done to the local community by the presence of that centre, the very many serious questions raised about its operations, its salaries, its expenses that came out of the audit, and other leaked documents that emanated from the centre itself. So we have a responsibility to ensure the highest possible level of probity in the way that tax dollars are spent. So, no, we have no intention. We think the management lost public confidence, and certainly the confidence of government in the way it managed. As you know, we did establish a emergency mobile safe consumption site in downtown Lethbridge, and my understanding is that the number of opioid overdoses, of drug overdoses in Lethbridge declined from August to September after the suspension of funding for that particular site.
Operator, can you please put through the next caller?
Thank you. Rafi Bouchikanian, CBC.
Hi, thank you for taking my question. I'm wondering, thinking back to the Uncle Covet campaign where you depict a single person going to a household and having a party and basically encourage people not to do that, how do you square that with the current exemption you're putting into place for 5 days? And can you maybe talk about how much you looked into whether, this would cause a spike in cases, or is it worth the risk?
Fair question, Rafi. So obviously, any additional social contact does increase some risk of transmission, but we have to balance that off against a lot of other considerations, especially mental health considerations. We know that Christmas time, for lots of reasons, is bound up with people's emotional and mental health, and we don't want to make the already serious mental health crisis in the province even more serious for people being completely isolated at Christmas time, like the case I shared about a recently widowed grandfather. And so on the balance, when looking at these factors, we decided, as has, I think, virtually every other jurisdiction we looked at, to allow for this one event over the holidays for a single individual. We think that the risk of increased transmission is minimal, and we would ask people to be still be careful. And I guess that's the point about those ads, which they make in a colorful way, which is, and I would direct this especially at seniors, perhaps grandparents who will be able to join their families, their kids and grandchildren now. That is, we hope that will help to make people feel more. Feel just more rewarded to be with close relatives at that time, but still please take basic precautions. And maybe I'd invite Dr. Hinshaw to say something about that.
Thank you, Premier. And I would just reiterate that if someone is joining another household and they have chronic conditions, or if they are someone who's older, that household needs to think about the ways they can make sure that that individual is protected and has opportunities to be a part of the experience, but at the same time that they still have that protection, again, keeping distanced, considering the use of masks in some circumstances, again, regular access to hand sanitizer if appropriate. And I do want to emphasize the point that while this is enabling that possibility, of course, people still have the option of doing remote or virtual gatherings and thinking of other ways to feel connected with family and friends this holiday. And that remains an option open to people at this time.
We have time for 3 more questions. Operator, can you please put through the next caller?
Yes, Rochelle El Souzi, City News.
Hi there. This question is for the Premier. Why make this exemption now for single Albertans days before the holiday when many people have already made their plans? Also, are you worried that some Albertans might use this exemption as a sort of loophole to attend multiple gatherings?
Thank you. On the second question, look, I think people who might be disinclined to violate the rules will do so anyway, unfortunately. We sure hope there's not many of those people out there. But if people are just going to blindly ignore these public health measures and put themselves or others at risk by visiting multiple households, that is a decision. It's an irresponsible decision, but it is a decision that they're probably going to make regardless of what guidelines and restrictions the government puts in place. So I would just say to those folks who might be so inclined to remember that there are people who have passed away in Alberta because they got together around dining room tables at Thanksgiving. And they did the most natural thing, the most ordinary thing, the most fulfilling thing, which was to be with family and friends at a celebratory time. But we know, this is not a theory, we absolutely know that people got infected, hospitalized, and went on to pass away from a virus that they picked up in those family and social gatherings at Thanksgiving time. So we would just ask people to be, if you're not inclined to follow government rules, fine. But how about considering the unintentional impact you could have on the lives of others? In terms of, look, we've looked closely at jurisdictions around the world, and certainly across Canada. Every other province is permitting a variation of this permission for a single individual to join one other household at Christmas. And again, I think this comes back to the need to balance it with the mental health imperative. We already had a mental health crisis in Alberta pre-COVID. COVID has only deepened that. Earlier this week, I presented the startling data about over 1,000 drug overdose deaths in this province. Part of that is connected to the mental stress and emotional stress that people are feeling. And if this is one small way that some people who feel particularly isolated at Christmas can have a renewed sense of connection, of being cared for, then I think that is a reasonable measure for us to take.
Operator, can you please put through the next caller?
Can I actually, before this question, I think it was Bill Kaufman or it was the Globe that asked about the returning travelers. And I just actually wanted to add a little bit to that, to Minister Shandro's answer, which is that we do not have any direct nonstop flights arriving in Alberta from the United Kingdom. My understanding is that the only direct nonstop overseas flight, apart from sun destinations to the south, that we are receiving is a KLM flight. Let me put it this way, the only European flight that we're receiving is KLM. That is from coming out of Holland. Pardon me. So so we're not getting any direct nonstops from the United Kingdom. We obviously are getting some passengers who touch down in Toronto or Vancouver from the UK that are then coming here. And as the minister has said, we do ask that those people get themselves tested. We have had, I think, real success with our travel pilot at the Calgary International Airport. And we would encourage the federal government to consider expanding that across the country, because obviously here in Alberta we get a number of people who transit through other Canadian airports. So it would be to our advantage to have more on-site rapid test screening. And I know that Premier Ford would desperately like to see that happen at Pearson Airport in Toronto. But it requires the federal government participating, because we're not going to, just like we don't have mandatory vaccines in Canada, we're not going to have mandatory testing. We're not going to sort of grab people on the way off the airplane and stick a swab down their nose. They have to voluntarily participate in the program, and the way to incentivize that is to offer a reduced period of self-isolation. That's how it's worked in Alberta quite successfully. We would urge the federal government to consider expanding the protocols for the international travel pilot to other major international airports in Canada. And I'm sorry, we'll come back to this question that just called in.
Operator, please put through the next caller.
Thank you. Yes, the next question is from Dylan Short, Edmonton Journal.
Hello, this is a question for the Premier. We've heard today that, numbers have sort of plateaued and hopefully are on the decline. I guess at this point, seeing what we're seeing now, do you regret not bringing in these stringent restrictions earlier? And do you still believe, as was reported in the Herald a few days ago, that people that called for a circuit breaker earlier were misinformed, seeing the numbers that we've seen now?
The answer is no and yes. On the first question, as Dr. Hinshaw just said, most of the impact of what we're seeing right now was a result of measures that were taken in November. Remember, there is about a 10-day to 14-day lag on impact. So the most stringent restrictions that were announced that came into force 10 days ago, we will only begin to start to see the impact of that in the days to come. So what we saw was that the constant increase in the growth rate abated as a result of measures that were in place in November. I think that actually confirms the wisdom of our layered and gradual approach. Secondly, with respect to circuit breaker, the point I was making in that article is there is not a single jurisdiction that has had a successful 2-week short, sharp circuit breaker. And I think that we give people false hope if we suggest that there's a silver bullet out there. If we just shut everything down for 14 days, we'd have a reset, we'd go back to very low numbers or close to zero. It just hasn't happened anywhere. Where people in my kind of position have pitched short, sharp circuit breakers for something like 2 weeks, inevitably they have gone on for months. And I'll give you the current example of the United Kingdom, where much of the UK went into what was advertised as a circuit breaker in October, and just this week they have expanded and deepened the restrictions to a stay-at-home hard lockdown in almost all parts of the United Kingdom. The Australian state of Victoria in, I think, 5 months ago, went into what was supposed to be a short, sharp circuit breaker, and those extreme measures stayed in place for over 4 months with extreme costs for their society. So my point is, I've always said that if necessary, we will regrettably impose restrictions as a last and limited measure to preserve the capacity of our healthcare system and protect it from being overwhelmed. But we don't want to give people false hope that you can sort of solve the problem of the pandemic over 2 weeks. It just hasn't happened anywhere.
Operator, can you please put through our final caller?
Thank you. The final question is from Charlotte Dumoulin, Radio Canada.
Oui, bonjour. La question est pour M. Kenny. M. Kenny, on voit ce mois-ci des églises ou des organisateurs de messes se positionner contre vos restrictions, mais aussi être rappelés à l'ordre par la santé publique. Alors, avec l'approche des messes qui arrivent le 24 et le 25 décembre, quel est votre message pour les croyants? Parce que certains vont se rendre encore dans les églises.
Évidemment, c'est permissible pour les Albertans d'assister aux églises. Moi, j'ai l'intention d'assister à ma paroisse pour la messe de Noël, si c'est possible, avec le nombre de personnes là. C'est une limite de 15% de capacité légale pour les églises ou les autres lieux de religion. Alors, évidemment, il y a autres réglementations, y compris une obligation d'utiliser les masques et de faire évidemment la distance physique entre les groupes familiales. Je crois que, comme le Dr Hinshaw a dit, la grande majorité des communautés de foi ont respecté rigoureusement les ordres de santé publique. Malheureusement, pour les petites minorités qui l'ont refusé de le faire, je dirais à ces communautés-là que c'est pas responsable de mettre à risque vos croyants, votre communauté et plus particulièrement les vulnérables. Nous savons qu'il y a les Albertans qui ont perdu leur vie à cause du COVID-19 qui a été transmis dans les situations de culte. Alors, c'est une liberté constitutionnelle importante. C'est la raison pour laquelle l'Alberta est une des seules provinces qui a gardé la possibilité de faire les célébrations religieuses dans les lieux de culte, mais il faut le faire de façon limitée, responsable et de prendre soin des autres. Ça, c'est certainement la règle d'or de toutes les religions, de toutes les traditions spirituelles, c'est de prendre soin des autres et j'espère que toutes les communautés de foi vont faire ça ce Noël. Et avec ça, joyeux Noël tout le monde et thank you very much and Merry Christmas.
As a reminder, Dr. Hinshaw will be back with another update tomorrow afternoon. Have a good evening.